COVID-19 declared pandemic in March 2020 by WHO. Globally, total number of infected cases till now more than 95 million. Number of COVID-related deaths till now more than 2 million. In India, total number of infected cases till now more than 10 million. Total number of COVID-related deaths till now more than 1.5 lakhs. Massive global efforts to create a COVID-19 vaccine. India rolls out world's largest COVID-19 vaccine program on 16th January 2021. India to administer vaccine to 3 crore people in phase 1, healthcare workers and frontline workers. So are you excited, nervous or scared?
Very excited. Can't wait to get my jab. I'm getting it today.
I'm very excited and I'm going to get my inoculation done today.
I am very excited about the vaccine. I am going to get it as soon as possible.
I'm very excited and I think I'm going to be the first ones to take it.
I am pretty much excited about this vaccination drive.
I'm still on the cautious side. I'm waiting and watching, see how the drive is going.
I've recovered from COVID, but I'm still nervous to get the shot.
So me too. I'm also very excited and just about to get my vaccine.
My own personal view is it's very advisable to take a vaccine.
So hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So yes, today is the D-Day. We all are getting the COVID vaccine today. But before that, let's learn some few facts about the COVID vaccine. How does the vaccine work? What are the types of vaccines?
So any vaccine works by developing antibodies in your body, and same is true for the COVID vaccine also. There are 2 types of COVID vaccine which are available in the country right now. The first one is Covishield and the other one is Covaxin. The Covishield vaccine is a vector vaccine, whereas the Covaxin vaccine is an inactivated viral vaccine. Both the vaccines are absolutely safe to take, whichever is available.
What is the dosage schedule?
So the vaccine is given in 2 doses. After taking the first dose, the second dose of the vaccine is to be taken after 28 days. You need to take the same vaccine that you took the first time around. Also, please take the second dose on time, otherwise the immunity that will develop may not be fully appropriate.
What are the recommendations for the vaccine for people with chronic medical conditions like diabetes and blood pressure?
So people with comorbidities, especially people above 65 years of age who may be having these illnesses, are more prone to developing complications because of COVID because of the lowered immunity. So it is essential for them to take the vaccine. Please do not be scared by hearsay.
What are the recommendations for COVID-19 vaccine for children?
So as we know about the disease severity, it is very less in children. Still then the vaccination is a must. It is safe. So whenever the government orders it for the children, obviously it has to be done.
Is it mandatory to take the COVID-19 vaccine?
No, it is not mandatory to take the vaccine. It is absolutely a voluntary vaccine, but it is highly recommended to take the vaccine. What are the side effects of taking a vaccine? Are these side effects serious in nature?
The very common side effects are a little bit of feverish and malaise feeling. So these are the very common side effects that people may feel. Then there are the common side effects, a little cough, sore throat, and itching and lump at the injection site may be there. And the rare side effect is the severe anaphylactic reaction which can happen. The serious side effects is a severe anaphylactic reaction which can occur with any type of vaccine or any type of allergen. It happens in 1 in a million inoculations.
What are the recommendations for the COVID-19 vaccine for a person who has just recovered from COVID-19 infection?
Yes, patients, those who have recovered from COVID infection should also get the vaccine. And there are 2 reasons behind it. One, the immunity which you get from natural infection is not lifelong, right? And second, some patients are getting the infection, but the antibodies are not developing. So the vaccine should be given in patients who've recovered from the infection as well.
Should an infected person with COVID-19 infection be given a vaccine?
Patients who are actively suffering from COVID should not be given the vaccine. They should only be given the vaccine after 40 to 45 days of the infection. I've also recovered from COVID. It's been 2 months and I'm ready to get the vaccine now.
Can a cancer patient be given a COVID-19 vaccine?
Cancer patients are a high-risk group for COVID, and the vaccine will be beneficial for them, but the risk-benefit ratio of the vaccine should be discussed with the treating team before the patient gets the shot.
What are the recommendations for the vaccine in pregnancy and breastfeeding?
So according to the Government of India, currently the vaccine is not being recommended for women who are pregnant or are breastfeeding. But with time the guidelines might change, but you should always discuss with your doctor before taking the vaccine.
What are the recommendations for COVID vaccine in elderly people?
So most of our patients are elderly and they have multiple comorbidities. For them, my message is plain and simple. Please take the vaccine and start your regular activity, because if you keep on doing your activities, your body will keep on functioning.
In which people COVID-19 vaccine is not recommended at present?
So people less than 18 years of age, those who are pregnant or breastfeeding should not take the vaccine. Also those who've had allergies to the component of vaccine, or they have certain bleeding disorder, are on medications which are blood thinners. Those who are immunocompromised or on the drugs which make the immunity compromised, they should not be taking the vaccine.
What challenges have healthcare administrators faced during COVID-19 pandemic?
I think the biggest challenge for all of us as a hospital was to keep our teams, our staff safe. Equally, keeping the staff energized during this period, keeping them motivated, because people went through a lot of inconveniences both at the personal and professional front.
Most important, the battle is yet to be won. Even after the vaccine, we are not supposed to let our guards down. We are still supposed to be wearing the masks, follow social distancing norms, and keep washing our hands frequently.
मैम एक बार आप अपनी आईडी दे दें।
Show me your ID, ma'am. Thank you so much. Now you are ready for the vaccination.
Thank you. So finally, it's the D-Day. I'm getting the vaccination. I've reached the vaccination room. My documents have been checked, and I'm just waiting for my turn. So now I'm a little nervous. So it's been half an hour that I've taken a vaccine. I've rested there for half an hour. So far feeling great. So time to go back to work. So this is Dr. Anjali Kumar signing off today. Wishing you safety, great health, and of course COVID-free days ahead. Don't worry, it's a safe vaccine. Take the vaccine when your turn comes. Complete the 2-dosage schedule. Do not forget to keep using the mask. Frequently wash your hands and follow the social distancing norms. And of course, don't forget to like, share and subscribe to Maitri, and I will see you soon.